Dear friends, welcome back to my YouTube channel Biology Classes. In the previous sessions we have discussed about two of the bacterial diseases and two of the viral diseases. Today in two sessions I am going to discuss about two of the Helminthic disorders. Helminth here basically indicates worms. The infections which are caused due to worms are referred to as Helminth infections. More particularly with respect to these diseases, we are going to discuss about Ascariasis. Globally, it is one of the very commonly found diseases which are caused by nematodes. And where do we find this disease basically? See, in the overcrowded conditions and also the regions which have very poor hygienic habits will definitely have the disease Ascariasis. And further, when we talk about its epidemiological aspects, let me tell you that it infects more often the children. The children are very intensive and symptomatic. They carry the symptoms most of the time than compared to the adults. Adults are generally not infected by this disease. Very rare conditions we can see them getting infected. Furthermore, with respect to epidemiology, let me tell you that out of 1,000 children, if we consider, at least 2 of the children will have intestinal blockages. Or even you can say intestinal obstruction. So these are very severe cases. Anyway, so this disease can be seen spread across many developing nations, especially Africa and Southeast Asia. We can find this disease also in some of the developed countries like United States of America and also few of the Gulf nations. So these are the epidemiological aspects of the disease Ascariasis. The Ascariasis disease is more particularly, caused by one of the commonly found roundworm called as Ascaris lumbricoides. So this is found in the intestinal regions of man. Almost across the world, we can find this worm infecting the intestine. Moving ahead, let me tell you, children are more susceptible to this disease because they have very unhygienic practices and they often tend to put different things in their mouth. When we take the causative agents, so this is generally Ascaris lumbricoides. And when we talk about the transmission, generally it is through orophycal route. So that is through the mouth and through the fecal route. Anyway, so transmission basically occurs when it is very important to understand. See, when children generally they swallow the eggs containing the embryos of Ascaris lumbricoides, definitely they stand a chance of getting infested with this disease. Generally, children, of course, they have unhygienic practices. They may consider having anything which is around them if they do not have that healthy practices. So that is the reason why I am telling children are more susceptible to get the disease. Okay, So moving ahead, let me also tell you, if we consider Ascaris lumbricoides, it will lay around 15,000 eggs in the host per day. In the host. So very important to understand. Most of the eggs will pass through the fecal route, but some of the eggs which are thick and if favorable conditions exist, definitely these eggs will, having embryos, will develop into vermiforms. So vermiforms, the small worms, Ascaris worms will be found. And definitely when these worms are again taken through the food, definitely they infect one more host. So this is the causative agent and the transmission of this disease. Coming to the symptoms of this disease, let me tell you, during the initial phases of infection, there we can definitely observe the worms in the stool, followed by fever. Along with this, definitely there will be shortness of breath. So breathing becomes very difficult. And my dear friends, very commonly, coughing, due to shortness of breath, coughing, and also we can find nausea together with vomitings. See, all these symptoms generally can be seen with respect to initial infection of Ascaris lumbricoides. Further, in severe cases, the symptoms vary. Along with these symptoms, we do find abdominal distension. So, wherein we can find swelling of abdomen. So this swelling of abdomen can generally be seen with respect to children. It is not generally seen with respect to adults. So there will be severe pain which exists in the stomach and abdomen. As I said before, most importantly, the severe symptom is that in children especially, a part of the intestine can be blocked, which really becomes difficult for the children, and in fact they suffer from malnutrition also. Anyway, so intestinal blockages or obstructions, so wherein surgery becomes very much essential. Anyway, so these are the important symptoms pertaining to the disease Ascariasis. My dear friends, these are the symptoms with respect to mild infection. With respect to severe infection, severe cases, chronic cases, you can find these symptoms along with this abdominal distension, severe pain in the stomach and abdomen, together with intestinal blockages can be seen. Dear friends, moving on to the diagnosis of this disease, particularly when we talk about this, the doctor will check for the signs and symptoms. That is, he will see the physical aspects of the disease, especially among children, wherein if there exists abdominal distension or swelling or stomach pains, abdominal cramps, then definitely the doctor will suspect that it might be any worm infection like Ascariasis. So further, what is done, I will tell you here. Say we have the feces, wherein this feces will have eggs or embryos in it. How to identify that it has eggs and embryos? We have techniques wherein we take smears. Generally 1 or 2 smears are made, wherein through these smears we can come to know whether we have Ascaris, lumbricoides eggs or embryos. And this is particularly done by taking the fresh fecal smears, and more clearly, or the visibility can be increased by two of the important techniques. That is, we have ether sedimentation technique followed by Cato technique. So what we basically do under these two is, in the slide we make the concentrate of the worms or the eggs or the embryos so that they are clearly visible. So when they are clearly visible, we can see to what extent the infection exists. As I already said you that approximately around 15,000 eggs are laid by the female in the intestine of the infected person. So in that case, there are numerous eggs. So that's what. Still, if we make concentrate and if we study, definitely the diagnosis becomes very, very clear and easy. So furthermore, along with this, let me also tell you, we can go ahead with X-rays and ultrasounds also, wherein the images of the abdominal region, especially the intestine infected region, can be observed. It can be done in more severe cases. Furthermore, my dear friends, when we look into the eggs of this Ascaris lumbricoides, so they will be oval generally, and they will have rounded thick shells. These rounded thick shells are covered by lumps, thick lumps. So their size is approximately 35 to 50 micrometer in diameter and around 40 to 70 micrometer in length when observed under the microscope. So we look for all these characteristics. If these characteristics are present, then the infection is severe. So furthermore, say in case of pulmonary diseases, lung diseases, wherein the fluids which are aspirated from the lungs may have the embryos of Ascaris lumbricoides. So these are some of the diagnostic techniques which are available for clearly identifying the disease. Dear friends, moving on to the preventive measures of this disease, it becomes highly essential to understand that as this disease exists in the developing nations, so proper hygienic and sanitation methods need to be followed. The first and foremost preventive measure is to, in fact, have access to the clean and hygienic toilets. So here the responsibility, the role of the government becomes highly essential, and also the non-governmental organizations, the NGOs should also participate to build the clean and hygiene toilets for the community people who does not have access to it. So this is the first preventive measure. Secondly, as usual, as every time I say, the hand washing with proper scientific techniques, wherein full complete fist under the nails, the fingers, between the fingers, all complete hand washing, with soap is properly followed. Every time when the person goes for the excretion of the feces or for the toilet. Anyway, there comes the third point. So here, safe and sanitary disposal of human waste or human excreta, especially the fecal matter. So which is generally not followed. In open, drainages and open sewages today, the community people go for excretion, which is very sad to see. In fact, my dear friends, it becomes the responsibility of not only the government and NGOs, it is the responsibility also of the common people to provide the common facilities like, the hygienic toilets to the, underprivileged people. So this is a third preventive measure which we can follow. If proper sanitary disposal of human excreta is done, my dear friends, believe me, we can definitely see that the incidences of this disease can be reduced. Fourthly, in many countries, there, human excreta, human fecal matter is used as manure or fertilizers, So there, the people should be very well aware that it should be compulsorily, the people should follow the washing techniques for food as well as, especially the fruits, vegetables, and many other cereals, pulses, whatever they are using, where this human excreta is used as fertilizers. So that should be followed without doubt. Okay. So apart from this, the fifth important preventive measure which can be followed, especially the children, should be taught good hygienic and clean practices in home, in the schools, and as well as in the community. So that's very essential. Next, let me tell you, children who are adopted by the developed countries, people of developed countries, there needs to be, very well important aspect they need to follow is that these children need to be screened and deworming medications should be given to the children so that they do not spread the disease from the developing country to the developed country. So that's very essential, my dear friends. Dear friends, moving on to the last segment of disease discussion, so we have the treatment. Two important treatments are followed here. One is by the use of Ascarias and another one is through surgery. So let me tell you, these two methods are followed depending on the symptoms which are seen with respect to the disease. Ascarias, these are prescribed by World Health Organization. Only those should be considered for the treatment of the disease. Other medications, if we consider, that may have other symptoms which may cause more, in fact, alleviation of the symptoms. So, okay, they may also cause side effects. So that should not be anyway considered. Only we have to consider the medications prescribed by the World Health Organization. Let me give you a few important medications which is been prescribed by World Health Organization. One is albendazole. Then we have mebendazole. Thirdly, levamisole. We also have pyrantel, pamoate. So these are the generally prescribed medications for the treatment of Ascaris, lumbricoides, which results in Ascariasis. Anyway, so further medications are there, my dear friends. Not only this, other than this, even other medications are also prescribed. Say for example, we have hexylresorcinol together with santonin, and we have finally oil of chenopodium. So hexylresorcinol, it is very effective against the immobilization and in fact the movement of the Ascaris lumbricoides through the feces. All this, in fact, all this immobilizes the worm or in fact their muscular response to acetylcholine is completely reduced, or further if I want to tell you, they generally cause the womb to be moved through the feces. So that much I can say. So I hope you can easily understand the treatment. So anyway, you need to remember that these are the medications which are prescribed by the World Health Organization, and in fact these albendazole, mebendazole generally are given to the high school or the college students because it also helps in prevention of the disease. Okay, dear friends, let me tell you, to reduce the symptoms of inflammation, we can even go for corticosteroids. So it reduces the inflammation which is seen especially in the intestine, and definitely it can reduce the severity of the disease. So these are the important treatment procedures which we need to in fact follow. I have already told you, surgery is performed in severe cases where there is intestinal blockage or intestinal obstruction. I will put up image in the video, please do refer, where how the Ascaris lumbricoides, after their complete reproduction, growth and development, they block a part of the intestine, which causes in fact so many disturbances with respect to metabolic functions, especially with respect to children. So anyways, friends, so please I request everyone to see the description, and follow up the notes which have been given for this disease. And further, I request everyone to subscribe, like, and continue to support this channel.